Non-operative sports medicine is really looking at one, prevention of injuries, but then also the diagnosis and treatment of injuries related to activity. So sometimes that's dealing with the sport, sometimes that's just the activity of just daily living. Any of that can be sports medicine. It can be anything from a 12-year-old with a throwing injury to a 80-year-old with knee arthritis. In a sense, we're all athletes, so we all kind of want to get back to the game of life. And so, no, we don't just treat people who are involved in sports injuries, but people who are injured, whether that's on the job or sometimes an accident at home. So fractures would be very common, dislocations, sprains, strains, concussion. Those are all things that typically would happen and be seen in the office. Depending on the injury, first you want to diagnose the injury, which would take you down the pathway of certainly making sure you do a good history and physical exam. Then you got to get the correct imaging. Once you kind of have the diagnosis, then you can proceed with bracing, casting, splinting, sometimes physical therapy, medication intervention, injections, and then sometimes orthobiologics. Orthobiologics encompasses a lot of different areas that are being studied and looked at that are kind of on the cutting edge, PRP and stem cell being the two that come to the forefront most commonly. And PRP is taking your own blood and spinning it down and separating out the layers of blood. We take the platelets and the growth factors, which we think stimulate healing. We inject them back into a site to promote healing, so it's a way to get your body to heal itself. A very similar concept with stem cells. So stem cells are pluripotent, meaning they can become any type of cell. And so the idea is to harvest those cells from a certain area of the body and put them into an area that's damaged or needs to heal or didn't heal appropriately, and stimulate your own body to heal that area in a better way.